today I'm going to be talking about the healthcare worker shortage and what effects improper acuity ratios have on this shortage. So you may be asking yourself, well, what is an acuity ratio? An acuity ratio, or what we also call a staff-to-patient ratio, is what outlines and manages the safety of a nurse's workload or team, which is also just the patients they're tending to throughout the day. So acuity is calculated based on the level of difficulty or severity of a patient, and this is what allows the workload to be equally distributed amongst our nurses. So to kind of put this in perspective, I work at the Cancer Center here in Logan, and for us, acuity is based on the difficulty of a patient's regimen. So going from simplest to most challenging, a 1 would be something like a blood draw, and a 5 would be a lengthy multi-drug chemo. This ratio is also different unit to unit. So here we can see on the right that in the operating room or the ICU, the ratio tends to be smaller, and they try and get it as close to a 1-to-1 ratio due to their patients typically being in a more critical state, where in a rehab facility or like the Cancer Center, nurses tend from anywhere from 3 to 6 patients a day depending on how busy it may be. This ratio is one of the biggest factors to safety on the floor, and there come great consequences when this is disproportionate. So let's look at some. The risk of making errors increases significantly when this acuity ratio is off. So I was lucky enough to be able to talk to one of the RNs that I work with at the Cancer Center named Tessa Sunderland, and she shared her thoughts about improper ratios by saying how horrific she has seen some of the errors be due to having too much on your plate. She then continued to express how implementing a solution is critical to having a safe and efficient healthcare system for both workers and patients. Again, going to safety, this causes our staff to be overworked and eventually can lead to burnout when these are disproportionate, as the shifts tend to be lengthy, and if the ratios are too high, then our nurses are running around all day long feeling completely overwhelmed. These ratios, when improper, can also decrease the quality of care provided and can even significantly increase the chance of readmission, since they may not be able to be tended to just like they need to be. So again, putting this in perspective, here is a little example. So on the left, it shows what improper acuity looks like in terms of nursing assignments. So in the bottom, it shows total acuity, which we can see throughout the 5 nurses there are, is not equal. And then looking at the acuity of each patient, some nurses are assigned all of their patients are higher acuity, and some are mostly low acuity. So going over to the right on the fixed acuity ratio, we can see how first at the bottom, the total acuity is equal amongst all the nurses. And then looking at each patient acuity, each nurse has a few more challenging and a few that are a bit easier. And this makes such a difference, as it doesn't make the nurses run around all day. It helps them equalize what they're doing, and it really does make a huge difference. But what's going to happen if these aren't addressed? Our healthcare system overall is going to become less accessible, as it can lead to overcrowding and increase the wait times again as more people are being readmitted or coming back for more issues that may have been easily solved the first time around. Caregivers will also continue to feel this burnout, which will even possibly lead them to leave the field. Our safety will continue to take a great toll, and our current system is not going to be able to tend to the growing needs and will eventually crumble if there is no action taken. So here on the right, we can see a little interview done that was put in a diagram by the Morning Consult, which interviewed healthcare workers in relation to what they feel has happened due to the shortage. And many were saying that they feel that there is much over capacity, and that the complaints come in from that, as people don't feel like they're getting the care that they need. And then they also see how this causes the workers to be burnt out and eventually leave the field. So overall, this shortage can become a very vicious cycle, which is a heavy workload leads to being overworked, which leads to a decreased quality of care and an increased risk of errors, which then leads to a higher readmission rate, which leads to more patients for nurses to care for, which leads to burnout and then caregivers leaving the field. So overall, this issue will just continue to grow in severity if it's not addressed. So if everyone wishes to receive the best quality healthcare possible, then action is must.